Shoulder arthritis generally refers to damage to the smooth cartilage that covers the ends of the bones. The cartilage gets worn away, causing the rough bone ends to rub against each other. This leads to irregular motion within the joint and the development of bone spurs called osteophytes, which are bony growth formed as the bone tries to heal itself. Irregular motion and bone spurs, along with inflammation, can result in pain and loss of motion in the shoulder. There are two joints within the shoulder that can be affected by osteoarthritis. The main joint that provides most of the motion is called the glenohumeral joint, or GH joint, which is where the arm bone, or the humerus, meets the shoulder blade, the scapula. The other smaller joint in the shoulder that does not provide much motion is the acromioclavicular joint, or the AC joint, where the collarbone connects to the scapula. The cause of osteoarthritis, OA, in the shoulder is usually referred to as being either primary or secondary. Primary OA refers to arthritis with no identifiable contributing factors, whereas secondary OA is being a result of an injury or disease. The most common complaint of someone with shoulder OA is pain and loss of function. Pain over the back of the shoulder is usually due to glenohumeral arthritis, whereas pain over the top of the shoulder is usually caused by acromioclavicular arthritis. The pain worsens with activities, especially with any activities that requires the arms to reach over the head. In addition, the motion of the shoulder can sometimes feel like grinding, also known as crepitus. As the bones rub against one another, an individual can gradually lose motion, which further limits their ability to do their daily activities. Fortunately, not everyone who develops arthritis develops pain and loss of motion. In fact, some people with severe joint destruction have very few symptoms. Shoulder osteoarthritis can be managed by surgical and non-surgical treatment options. The main surgical option is a total shoulder replacement. In cases of severe arthritis, it may provide pain reduction and allow patients to increase their activities of daily living. Shoulder replacements tend to work better on older individuals who have low demand on their shoulder. Fortunately, there are a number of good non-surgical treatment options available for symptoms of osteoarthritis of the shoulder, including exercise, activity modification, physical therapy, non-steroidal anti-inflammatory drugs, also known as NSAIDs, and intra-articular injections. Hot and cold treatment can also provide some relief. While cold is helpful for reducing swelling, especially in an acute injury, it can also be helpful for chronic pain or for the pain and inflammation of an arthritis flare. For aching shoulders without acute inflammation, heat may be helpful instead. Exercise can be a useful way to help manage arthritis symptoms, but it's important to be careful with certain activities. Shoulder arthritis can be aggravated by heavy lifting or overhead activities. However, reducing activity too much can be detrimental, and it's important to maintain strength and range of motion in joints affected by arthritis. You may find non-impact activities such as Tai Chi or water exercise helpful, as they can support range of motion without adding stress to the joint. Regular exercise of the shoulder muscles can help reduce pain, support healthy cartilage, as well as increase range of motion and function.